Dr. Jesse Houghton, board-certified gastroenterologist. I've been really busy lately, and so I haven't had the chance to do a video recently, and so I'm making a point to do one on what I feel is an important topic. I wanted to discuss a couple very common symptoms that we are seeing more of recently, and that is nausea and vomiting. There are many causes of nausea and vomiting, but I'd like to discuss two in particular. Number one, the GLP-1 agonists like Ozempic, Trulicity, Mounjaro, Byetta, Bydureon, Victoza, and there are a few others as well. Don't get me wrong, these medications are great for glucose control and diabetes, and also generally do allow people to lose weight. However, it is very common for these medications to cause GI side effects, namely nausea, vomiting, bloating, and either diarrhea or constipation. We are seeing this quite commonly as more and more people are put on these types of medications. What do we do when this happens? Well, there are a few options depending on the patient. Sometimes the symptoms will improve over time without doing anything different. But probably the most common option is to lower the dose of the GLP-1 medication. As the higher the dose of these medications, the more likely one is to have these types of GI side effects. However, some patients may not be able to tolerate these side effects even with a lower dose of the medication, and will need to ultimately stop the GLP-1 medication altogether. I should mention that we can add an anti-nausea medication to treat the side effects of the GLP-1 medication, and this may work. However, some of these nausea medications counteract the mechanism of action of the GLP-1 medication. One of these medications is Reglan, which makes the stomach contract to push the food along. But do you really want to counteract the mechanism of action of the medication that you are using in part for weight loss? In summary, the GLP-1 agonists are an important class of medications for diabetes and for weight loss. However, more people need to be aware of the potential GI side effects of these medications, some of which may require stopping the medication altogether. For part 2 of this video, I wanted to discuss nausea and vomiting from marijuana use. Now, I have talked about this previously, but it bears repeating. If someone smokes or vapes marijuana or takes edibles on a daily basis several times a day, they can actually have the opposite effect on nausea and appetite, actually creating cyclical episodes of continuous nausea and vomiting, followed by periods of feeling fairly well. This condition is called hyperemesis cannabinoid syndrome or hyperemesis cannabinoid syndrome. How do we make this diagnosis? Well, it's mainly a clinical diagnosis. So, someone who's having issues with cyclical nausea and vomiting, who also happens to smoke marijuana every day, and someone whose symptoms improve with hot showers or hot baths. That's the key feature. These patients almost always to a T feel better with hot baths or hot showers. How do we treat CHS? Well, we can try to counteract the symptoms with nausea medications such as Zofran, Reglan, Phenergan. But ideally, we want to get at the heart of the problem and have the patient significantly cut back or even stop using marijuana. And I know this is often easier said than done. I hope that helps some of you. Be well.